Hi, this is Dr. Amie Harwick, and today this video is going to be all about what is a sex therapist. I get this question all the time. People don't know what I do, or they have all these misconceptions about what sex therapy is. So right now I'm going to break it down and tell you what it is I do and what it is a sex therapist does. Years ago when I was in graduate school, my mom and I were on the phone. I said, "Mom, I think I'm going to specialize in sex therapy. I'm going to be a sex therapist." And she said, "Does that mean you're going to have sex with people?" And I thought at that moment, even my mom, who's an educated woman, had no idea what it is that I do for a living, no idea what it is that I do or that I want to do. So I had to clarify with her, "No, Mom, that means that I'm going to be a therapist, but I'm also going to work in the area of sexuality and be more sex positive." And she still was a bit confused, but supported me. So because of that situation, I thought it's very important for me to make this video and tell you about these misconceptions about what a sex therapist does, and also break it down on what it is I actually do. Let's start with the common misconceptions. Number one, a sex therapist has sex with their clients. Nope, a sex therapist cannot have sex with their clients. I can't even really touch my clients. Legally and ethically, a marriage and family therapist is not based on touch. So even if I want to give my clients a hug or pat them on the back, I typically don't, because it's talk therapy, and that's just not within the legal ethical guidelines of what I do. Misconception number two is that a sex therapist only works with sex addiction. Actually, sex addiction is more of a socially created word or term. The DSM, or how we diagnose people, and CAMPT, which is the California Association of Marriage and Family Therapists, don't support that. It's actually not a diagnosis that we diagnose people with. So you can have a compulsivity issue where what you do compulsively or your urges don't really work for you and could be unhealthy, but you can't actually be diagnosed as a sex addict. Another thing is that ASECT, the American Association of Sexuality Educators, Therapists, and Counselors, they don't even support the idea of sex addiction, because they said there's not really enough empirical evidence to support both sex or porn addiction. So because of that, I don't work with sex addiction, but I may work with people with compulsivity issues. Misconception number three is that a sex therapist is not a real therapist. Well, typically, a sex therapist is somebody who is licensed in what they do, so that might be an MSW, a Master's in Social Work, or a licensed social worker, an MFT, which is a licensed marriage and family therapist, an LPCC, which is a licensed practitioner of clinical counseling, a PsyD, which is a clinical psychologist, or somebody who's licensed with a PhD. So all of these people with additional training and expertise in sexuality could be a sex therapist. Typically, a sex therapist is not somebody who would be unlicensed or a life coach. They could be a sex expert. It could be a life coach specializing in sexuality, but that would not be a sex therapist. And lastly, misconception number four is that a sex therapist just talks about sex all day long with their clients, and that's not really true. Maybe for some it could be, but generally that's not the case. So because a sex therapist is a licensed therapist, I work with clients that have depression, anxiety, change of life issues, but because I have an extra expertise in sexuality, I might talk about sexual issues or intimacy more than maybe the typical therapist, but it's definitely not what I talk about all day. Sorry. And sexuality is within the scope of practice, so that means that it's under the umbrella of all the things that any therapist can be qualified to talk about. So you don't even have to be a sex therapist as a therapist to talk about sexuality and intimacy with your clients. So how do you specialize as a sex therapist? What does one do to make them an expert in that field? Well, the California Association of Marriage and Family Therapists says to be able to specialize in any area as a therapist, that one must get special education, training, and expertise in this specific area. But they don't really say exactly what that means. And for every area, it's going to be different. So how do you take that information and ethically be a sex therapist, specialize in that? Well, all I know is kind of what I've gone through. So let me tell you what makes me that specialist, and other people could be pretty comparable in their background as well. So I have my bachelor's in clinical psychology. During that degree, I took a few courses that had to do with sexuality. Okay. I have my master's in clinical psychology with an emphasis on marriage and family therapy, and in that I took a few courses on human sexuality as well. I have a license, so that means I did 3,000 hours of interning or working under other therapists, and one was a sex therapist. And I also worked with sexually exploited teenagers and child sex offenders in that interning period of time, which took, I think, 5 years to get. After that, I did a PhD in human sexuality at a very small specialized school. I did a SAR, which is a sexual attitudes readjustment course, where you really learn about yourself and sexuality in general, and I would recommend this to even non-therapists to take to help your self-discovery. After that, I wrote a book called The New Sex Bible for Women, so I've been published, also been published in a lot of magazines and online articles. I've done a lot of media work as an expert on TV shows. And finally, I'm a member of professional organizations like LASA, the Los Angeles Sexologists Association, and ASECT, which is the American Association for Sexuality Educators, Counselors, and Therapists. So using all that information, what does a sex therapist actually do? Well, a sex therapist will use their knowledge of psychology and physiology to address sexual feelings, sexual intimacy, and sexual issues on top of all the other things that one might do as a therapist. So one could be a sex therapist, but you could also be a therapist that's just sex positive. The sex positive movement in general emphasizes two really important things, and that's safe sex or safer sex. So no sex is totally safe, but safer sex, and the importance of consent. And if those two elements are there, that most sex and most things involving safer sex and consent are essentially healthy and pleasurable. And it doesn't put moral distinctions on how you do that. So whatever it is you do, as long as there's consent and it's relatively safe, it's okay. And that means if you have all the sex in the world, so there's a stigma that people that are sex positive or therapists that are sex positive emphasize lots of sex or lots of very kinky sex, and that's not the case at all. So it represents the extreme of lots of sex, but it also represents something as asexuals, people that identify as adult virgins, or people that have lower sex drives. It's all okay. So there's no moral judgment, safe sex, consensual sex, and those are the things that I really emphasize in my practice and that a sex positive therapist would also emphasize. So thanks for watching the video on what is a sex therapist. If you have any questions or comments, feel free to leave them below, and please feel free to check out my website or my social medias, and feel free to ask me any questions, comments, or engage in any way about this topic. It's an important topic, sexuality in general, therapy and mental health in general, so let's be visible and have a lot of conversations about it. Have a great day.